Hi, so today we'll be talking about post-discharge training and continuing education. So, post-discharge training is allowing the patient to contact you for how long they feel, or you contact the patient however long they feel is necessary past your discharge date, their discharge date. Um, and that's very important because people with disabilities and people that process things slower than other people like myself, I process things slower. We might need more time to get used to life outside of the unit again. Or that's also why a step down program is so helpful, as it helped me get used to life outside of the unit again slowly. Yes, I was still stressed because of other things that were going on in life after discharge, like doctor's appointments and stuff, other things, but I at least had some time to get used to life that was kind of like hospital, but also home. So, partial hospitalization is basically, I think I've said this before, but I'm saying it again. At least in the program I was in, you go from 9 a.m. to 3 p.m. And you get there for check-in at 8:45 a.m. Um, and then from there you step down to the intensive outpatient program, which is only from 9 to noon every day. Well, no, I take that back. It was 9 to noon Monday, Wednesday, Friday versus 9 to 3 every single day, Monday through Friday, versus 24/7, like 24 hours a day, 7 days a week, like for however long you're in the year. So it slowly, gradually um, stepped down to fewer and fewer hours at the hospital. And then after I was discharged from IOP because of my seizures, I was just back home doing my normal stuff, normal activities, normal everyday living. Um, except for this time around, um, whenever I saw something regarding epilepsy on Facebook, I'd copy it and post it in the group chat of all of us that met in the unit, all of us trolls, just to keep them informed of like what's like going with epilepsy, because they wanted to know how to help me and stuff when we were in the unit. So I just thought it was important to keep them on the loop and stuff, so that they all know about me waiting to be in the epilepsy monitoring unit. And for the post-discharge training, like I said, is continuing education. So being paid to go get classes or take classes for the staff to learn better ways to handle people that come in with what is considered comorbidities, meaning both physical and mental health problems, and seeing how like having somebody specific there with the person with disabilities can be very helpful and so dramatic for the person while they're on the unit. I am actually continually learning about everything that I deal with myself. So, like, you could always, even the continuing education doesn't necessarily have to be going to school or a class um, to get credits. It could be asking former patients that might have had disabilities or that, have disabilities come to the unit and talk to the current staff um, during like a break time, like when somebody's different staff members at different times, because on the unit you always have to be ready. You need to help have multiple people and workers on the unit at all times. So like maybe go to a room inside the unit where there is no patients and like they eat. You get to talk to the former patient and see what would have helped them when they were in the unit or what they think needs to be changed. That would be definitely helpful, along with having people with actual disabilities as workers on the unit to be with as the one-on-one person for people with disabilities. And just continually learning by maybe looking up on websites about different disabilities like epilepsy, whatever the disability might be, ADHD, um, autism spectrum. Yeah, that ADHD and autism spectrum disorder technically in the diagnostic manual, but that's another thing. Maybe take those out of the DSM because those aren't really mental health related conditions. They just come along, like mental health comes along with them a lot of times. They're technically disabilities and they just like epilepsy. A lot of times people with epilepsy, in fact, 1 in 3 people with epilepsy um, will develop anxiety, depression, um, along with that, like suicidal thoughts because of their medications. So I know that I am and I just found that out again today when I was looking on Facebook. I think I found that before, but maybe I haven't. I can't remember exactly if I've seen that before or not. But a third of all people with epilepsy also have, as what I saw on Facebook, put it, psychiatric conditions. So, yes, anxiety, depression, PTSD, those are all mental health related, like mental health conditions, whereas autism and ADHD in my mind are not. They're either disabilities that come with epilepsy, for example. A lot of people with epilepsy do have those as well as, like I said, anxiety, depression, PTSD, medical PTSD. And this continually like ask because you already have their records, so you know who's been on the unit and you can come and talk. Maybe have them come and talk to the current patients on the unit about what it's like to have a disability and mental health conditions so that the current patients learn from former patients as well. That's another way that you can continually learn is just have it as a group option for when people are on the patients are on the unit. So this entire staff were here, what's going on. And a lot of people, I'm sure, plenty of people with disabilities and mental health conditions would be willing to share what it's like having both combined. I know I'm up for that, um, and I'm willing to do that at any hospital here in Maryland. That is it for tonight, and I will talk again tomorrow. Thanks. Bye.